Hi, everybody. I believe I'm live. This happens to me every time. Okay, good. It says I'm live. I don't know. Sometimes you just don't know. It's kind of confusing because the screen doesn't show up right away. You guys, I'm going to wait a few moments because I did say I was coming on live at 11:15, but that was only about 20 minutes ago. So I understand that possibly people are just logging in. I'm just going to say hello in the chat. I've decided I would like to come on at least monthly for a live Q&A, anything dental related. If you guys have any dental questions, now is the time to ask because sometimes I can't respond to comments right away. I get a lot of amazing comments, you guys. Thank you so much. But it is hard for me to keep up with them. I do apologize. So this way, you guys can ask me any questions you like anytime as long as it's dental related, but it can be anything. So if you're a dental hygiene student, if you are a dental assisting student, if you're a current dental hygienist, where you just have questions about anything, I do offer consulting services also. So I do a little bit of everything. If it has to do with dental, I'm the one you want to go to, you guys. I've been in this profession for about 17 years now. I've been teaching, tutoring, consulting, and I do have my own dental hygiene mobile practice. I see patients in my own home, but mostly I travel to patients' homes. So I see adults, kids, those who have anxiety. I love it. So I love to help other people as well. I'm going to leave my website, you guys, down below for anybody who has questions. And I usually make note of questions that people have as well. Let's see. So I'm going to quickly answer those ones. And then if you guys have any questions, feel free to type in the chat box. I will be live streaming for about a half an hour. So now is your time to ask. I'm just moving along a couple things here. I'm just moving one screen because I had a question about the loops that I bought on Amazon and what I think about them. So I uploaded, I feel like I talked about this in the last live stream too. So sorry if I did. But talking about the loops. So I had ordered loops from Amazon. I'm just grabbing the link right now because they keep changing the link where they were $60, $60 to $70, depending on when you order them. The price always changes, right? As we know. I still love them, you guys. I've been using them for what? How long? At least a few months. I want to say maybe 4 or 5 months. I love them. I have bought loops before for $2,000 and I like these ones the same. I'm telling you, I will never buy $2,000 loops again. You don't need them. But I do not have an eye prescription. So if you do, if you have trouble seeing close, then you might want to invest more in loops. It's hard to say, but these are perfect for me because what do? They offer magnification, and that's all I need. Um, I can't seem to find the 2.5 magnification right now. That's what I have. 3.5 just simply means they're magnified more. So you might actually like that more. I'm going to give you guys the link to the exact loops that I have purchased, but they're 3.5, not 2.5, just so you guys have an idea. And they're $67 right now. They're normally 76 apparently. So even when I ordered them, they were on sale too. Whoops, I should mention what that link was for. So yes, I love those loops. I use them every day, you guys. They come with a light. If you're going to purchase loops, you need a light. Just saying. Good question. So somebody's asking, why are dental assistants underpaid? I agree with you 110%. I started off as a dental assistant way back in the day, 17 years ago, making, I don't know how I remember this, but I made $13 an hour. They do make more now, depending on where you're located. Dental assistants can make anywhere from $18 an hour to even $30 an hour. Around here, it's typical to make $18 to $20 per hour, maybe $22 per hour. But I agree, they are underpaid. I was a dental assistant, so I can say that. You literally have to do everything. Without you, the dentist doesn't know what they're doing. Who is going to set up the tray? Who is going to get all of the materials? Who is going to do all of that? So I can't answer that for you, why dental assistants are underpaid, but I do agree they should be paid more. If you're a dental assistant, make sure you get a raise every year. Make sure you get at least a $1 raise every year. Do not accept less. If you haven't had a raise in 5 years, I would ask for a $5 raise and say you haven't had one in 5 years. If they don't give it to you, look for another office. I don't know. Again, depends on the location, but around here, we need dental assistants. We need a dental hygienist. So you guys, we are in full control. If we're not happy with the office, leave and find a better office. But I tell people, if you like your office, if you get along with everybody, you have a good time when you're there, you have a great office. And sometimes, even if you're not being paid what you want, it might be worth it. It's a lot worse to get paid a lot of money, but hate your office. You hate going into work every day because you don't get along with the staff. You just hate the patients, like it's just not a nice place to work. Then it might not be worth the money. So please look into that too. I hope that answered your question. If it didn't, let me know, and then hopefully I can try again. Um, can anyone work in the USA as a dentist who is not from the USA? Um, Good question. Yes, I believe you can, but you have to take certain tests, certain exams, depending on where you're coming from and what type of education you have. You might need to take a whole dental program in the USA. So it does depend. I can talk more specifically if you're going to be a dental hygienist or a dental assistant, because that's what I have been and that's what I am. But being a dentist, I don't necessarily know their rules and regulations, but I'm pretty sure it does depend on your current education. So you want to reach out to the dental association specific to that state where you want to work, and then they can help you with that. So there is always options. There's always things you can do. From India, no, I'm pretty sure you still can, but still, it depends on a couple different things, and it depends on the state where you want to work. So I would reach out to the dental association specific to that state where you want to work, and they can let you know. At the very least, you will need to take a dental exam, but they might also want you to update certain courses, or they might be so happy with your education that they might say, no, you're fine. So it does depend. Good luck. I think that's very exciting. Does anybody else have any questions? I'm just going through some of the recent ones. Yes, I've been talking a lot on my Facebook page about my mobile RDH Academy course. Yes, if you are able to have your own practice as a dental hygienist, in some states you can, some you can't. So you need to know that information. But if you can, so for example, here in Ontario, we can have our own practice as a dental hygienist. We don't need to work under a dentist. So my course, the Mobile RDH Academy, is I teach you how to do that from step one to step done. So I teach you how to talk to the bank about taking out a loan, how much approximately you might want, depending on if you're having your own practice in your own home and seeing patients mobile, or just seeing patients mobile, or just in your own home. So I talk to you guys about that, because that's exactly what I have done. November 2018 is when I started my dental hygiene practice, and I had to go through everything on my own. There were no courses. I mean, there were courses, but not very helpful ones. I'm not going to mention names. Some very official courses, but they just didn't help me. I felt like I needed more. I felt like I needed support from an actual dental hygienist who actually had her own practice, not just kind of like what we should be doing. So that's what I offer. So I help dental hygienists do all of that from like step one to step done, like I said. So yes, it's a full course. If you are allowed to have your own dental hygiene practice, I can help you guys. So I find that's a very exciting thing for sure. Another great question. So this is pertaining to dental hygiene students and dental assisting students. Asking about my VIP Board Exam Prep Academy course and then also the Express course. What are the differences? So if you guys go to the website, I do actually list the differences on the website. You just have to click the course that you are interested in. So the VIP Board Exam Prep Academy course, you have full access to everything, any tutoring, any live class, any board exam boot camp. You have access to everything for 2 whole years. So that is actually the VIP package. You get everything, anything, full support. Plus, you have full access to all of the PDF files, the video uploads, all of that. That teaches you how to pass the board exam. And yes, this pertains to Canada and the States as well. There's a separate course for dental hygiene students and a separate course for dental assisting students. The express course is meant for those who just need a quick review before they take the board exam. So if they're taking the board exam next month or in 2 months, that might be more suited for you because you don't need everything and you won't have time to study everything. So the express course, you get limited access of a little bit of material here and there that is meant for a quick review before you take the exam. There's mock exams in there, quizzes, case studies, all of that. But it's meant as a quick review and limited access. So I hope that that makes sense. What other questions? Yes, for those of you who aren't sure if you can have your own dental hygiene practice, you will need to reach out to your dental hygiene association in your area because I can't possibly know every state, every area. So you reach out to your dental hygiene association if you can have your own practice. And if you can, then you're going to want my course, the Mobile RDH Academy, because I go through everything with you. You have full support. I do also offer individual business coaching as well. So if you feel like you need more than just a course, you want me to help you privately, then yes, I do offer that as well. Because the goal is to have your own business, but to also make a full-time income, to make a great income because you'll be leaving your dental office job working for somebody else, but you need to make a good income and limit your expenses to make a good income. So I help you guys with that. So I think it's pretty darn cool. I know. Does anybody else have any questions? Just going through my notes again here. A lot of people are asking about the oral science website that I talk about when I talk about my xylitol products and my sodium fluoride products. So can I share my screen? Oh, no, I can't. I keep forgetting. Can I? There's an arrow at the bottom. What does that do? Oh, no, that shares the live stream. Okay, I don't want to do that. I think I've tried that before. Let's see. So sorry, guys, I can't share my screen, can I? Well, that seems kind of funny. I'm just checking. No. Okay. Well, anyways, I guess I'll leave the link down here for you. So if you guys are asking about the oral science products, I go to oralscience.com. As a dental professional, though, I can buy a lot of one product and save money. So that's typically what I do. So I have products on hand, such as anything with xylitol, like they have toothpaste, mouthwashes. Anything with sodium fluoride. So I talk a lot about xylitol and sodium fluoride to my patients. If they're cavity prone, I'm specific to the sodium fluoride, but also xylitol with the sodium fluoride, because if they keep getting cavities, sodium fluoride isn't enough. They need to add xylitol into their normal dental hygiene, like what they're doing. So brushing and the mouthwash. But xylitol products are hard to find over the counter. So at least I know with Oral Science, they have anything and they have all of them. So I will either tell patients to buy them themselves. They can do it online, but I typically have a lot in stock because I find when you're talking to your patients about a product, if you have it there for them, like I wish I had one to show you, but if you have it there and then you can say to them, here is the mouthwash, this is only $20, you can have it now, this is what you should be using to really help your mouth. They are more apt to buy it. If they say to you, well, yeah, that sounds awesome, but I don't have time to go out, I might have time to go shopping on Thursday, maybe I'll buy it then, they're going to forget. But if you can physically hand it to them, I find that that works so much better. So oralscience.com is where I typically go for most of my dental products. No, they are not paying me to say this. This is just personally what I give to my patients because I've really noticed a difference in less plaque, less tartar, less cavities, less everything. If their mouth is happier, if their mouth is healthier, I'm happier, they're happier, everybody's happy. So, as a dental professional, you need to be researching these products so you can recommend these amazing products to your patients. Any other questions, you guys? I think those were actually the main ones. I just did a live Q&A not that long ago, so that's okay if there's not too many questions. I have a snow day today, so that's why I'm working from home. I was supposed to see patients, you guys, but a snow day means I stay home, so I have extra time. Oh, yes, whitening products. Great question. I'm just checking on Amazon now. Do not buy whitening products from Amazon, you guys. No, because they're not FDA approved. If they're not FDA approved, as a dental professional, as a teeth whitening technician, we're not legally allowed to recommend them to our patients. So just don't do it. Okay, you guys? I'm sorry, but just don't do it. Just don't do it. You need to get your teeth whitening products from a teeth whitening company, from a dental, I mean, not even a teeth whitening company, because some teeth whitening companies aren't FDA approved. So I want to say from a dental company, you need to be getting your teeth whitening products from a dental company. If you're a teeth whitening technician, if you are a certified teeth whitening technician, you get full access to wholesale products anytime. And those are what you should be using on your patients. So do not get like your hydrogen peroxide syringes, your carbamide peroxide syringes from Amazon. They're not FDA approved and they also don't work, you guys. They don't work. And you're putting this in your mouth. So you really want to be careful what you're putting in your mouth, right? Like, does that make sense? You don't just want to put anything in your mouth. You don't know what's in it. And whitening toothpaste don't really work either. They work if your teeth are already white. So if you've had them professionally whitened, then use a teeth whitening toothpaste to really help to limit the stain from coming back. Because what a teeth whitening toothpaste is it's a little more coarse. So it works to brush away stains easier than a regular toothpaste. But teeth whitening toothpaste can also be too coarse. So they can actually be too rough on the enamel if you haven't been examined by a dental professional first. Sometimes I will professionally whiten patients' teeth, but then I'll say to them, but your enamel is too thin to use a teeth whitening toothpaste. It's actually safer for you to not use a teeth whitening toothpaste, but have your teeth professionally whitened maybe once every 6 months. That will keep the stain away. But then some patients, I say, you would actually benefit from a teeth whitening toothpaste because you have strong enamel, but you also stain easily. They might be a heavy smoker. They might drink a lot of coffee, tea. So it really does depend. If you're getting your teeth whitened, you want to go to a dental professional or a teeth whitening technician because they have been trained to know the teeth, know the mouth, know stains, and then they will recommend certain products to you. So does that make sense, you guys? Yeah? We have about 10 more minutes. Any other questions? And then you guys, I do have to go in 10 minutes because I am teaching today. I'm teaching dental assisting students the crown and bridge procedure. So we are doing tray setups all week in my VIP board exam prep academy. We are doing tray setups, which is always fun because I find in school you briefly go over the tray setup, but then that's kind of it. So it's nice to have a good review. This is usually a favorite class among my students for sure. Yes, I do offer teeth whitening training. So I do offer a teeth whitening certified course. So after you take my course, you have full access to any teeth whitening wholesale products. You will get a certificate once you pass as a teeth whitening technician. So you can be a teeth whitening technician. I can leave the link for you guys down below as well. Let's see at whiteteethschool.com. Nice and simple. Whiteteethschool.com. Hello. So nice to see you. Yes, this is being recorded. At least I believe so. I did click for it to be recorded, but I kind of feel like sometimes it doesn't work. So hopefully this is being recorded. And yeah, you guys, like I am literally just looking on like Amazon now, and they have all kinds of weird products for teeth whitening. Don't do it, you guys. I'm telling you. Like these like products don't make any sense. Like it's very strange actually. Yeah, guys, just don't do it. Are there no other questions? If not, then I will let you guys go. I believe I went through all the notes. I will likely do another Q&A in March. Please remind me if I forget, comment on a video and say, don't forget you're supposed to do another Q&A, okay? Okay, guys. Well, if that's it, I will let you go. Thank you guys so much. I will talk to you guys soon. There will be some new video uploads this week, so stay tuned. If you haven't yet, please click like to this video. That does help me and my channel. And make sure to click the subscribe button because that also does help me and my channel so I can continue offering free content. So thank you guys. Have a great day. We have a snow day here. Hopefully, it's not too bad where you are. And I'll talk to you guys in the next one. Okay? Thank you guys. Bye for now.